The reality of so-called Obamacare is that it's anything but affordable for many.
And joining us tonight to discuss the financial impact of the healthcare reform legislation is healthcare insurance broker Craig Gussin. Craig, Steve's story pretty much hit the nail on the head just a minute ago. I mean, a family of 5 now projected to be paying $20,000 under Obamacare. Last year, it was, what, $15,000?
Probably even less than that. I would say less of 10.
Yeah. What's going on here? The president promised things would be cheaper under Obamacare. We're not seeing that.
What happens is very simple. My average client will look at the rates going up and say, you know, I think I'll go to a higher deductible. So instead of having a $2,000 deductible, I'll go to a $5,000 deductible. I'll save $5,000, $6,000, $7,000 a year. And they're very happy with it. Well, come January 1st, 2014, the highest deductible allowed is $2,000. So I have a $2,700 deductible because I don't go that often. I mean, you know, guys don't go to the doctor a lot. So if I'm only going to spend a couple $100 a year in medical bills, it's worth it for me to save my money per month and pay it when I use it. Well, a lot of people do that. They have a health savings account where they can put money in. It's like a medical IRA. And that money grows and grows and grows. And when you don't use it, because it rolls over every year, well, you're not going to be able to do things like that because your maximum out of pocket, your deductible now only goes to $2,000. So if you have a $5,000 deductible going down to $2,000, your rates have to double.
So the deductible is the big problem in all this, huh? Yeah.
On top of that, 5 years ago, we didn't have free preventative medicine. We didn't have free prescriptions for women to get their birth control pills. And the president came out, what, Friday, Saturday, and said, we're going to work out a plan where the government's going to, the insurance company is going to pay for the prescriptions. They're not going to pay for the prescriptions. They're going to increase all of our costs $10 a month, and that $10 a month is going to pay for every woman in America, whoever, to get, you know, the free prescription.
Somebody always pays the difference. I know a lot of seniors are very concerned and worried about their medical care and their future under Obamacare. How is it going to affect them?
What you're seeing is exactly what you just heard on your TV. Doctors are going to either retire or stop taking seniors because they can't afford the small amount of money they're going to get. They won't even pay their bills. So what happens is every time you hear the government say we're going to pay less money for Medicaid, less money to the doctors who take Medicaid and Medicare, that means the doctors are going to turn around and increase what they charge the insurance companies to make up the loss. So a lot of seniors, and we're all going to be there one day, are going to lose a lot of the doctors that we currently have because they're going to say we're not going to take it. And on top of it, as you just said, doctors are going to stop practicing medicine because they can't afford to even make a living.
As I understand it, Obamacare, or at least a major part of it, kicks in next year.
January 1st.
January 1st. So what is the state of California doing right now to get things on track for that? How can people sign up? Where will they go to sign up? I mean, there's a lot of information that needs to be dispersed out there for the average person to know about.
We had a meeting 2 weeks ago. We had all 8 of the top insurance companies there. And the question I asked them was, what health insurance plans will look like in October 1st, 2013, because it's required by law to have it up and ready. And they said, we don't know today because we haven't gotten all the answers from Health and Human Services. So nobody knows today what the plans will look like. I couldn't give you a guess of even what my plan would look like January 1st.
Repealing Obamacare is a top conservative goal.
It's never going to happen.
How likely not?
Never going to happen because there's a lot of good things. Kids are covered under parents to 26. They have, you know, it guaranteed you health insurance for everybody. There's a lot of good things in it. Having free health insurance for everybody makes my life a lot easier. I don't have to come up to Sandra and say, hey, Sandra, Rudy, sorry, but I can't cover your whole family. Now I get the whole family covered, but it wasn't done right. There's not enough incentive. If they're going to charge me $2,000 for a family of 4 not to have health insurance, and that's my fine, I might gamble and do that. And see what happens. And a lot of people may do that. We're hoping that what they do is they allow higher deductibles. One of the big keys that really happen, that's really going to affect kids, and nobody talks about it, is that the ratio between a 20-year-old and a 60-year-old is 5 to 1. So if a 60-year-old costs $500 a month, the 20-year-old costs $100 a month. That ratio has changed January 1st, 2014 to 3 to 1. We already know the 60-year-old is going to cost $500 a month. So now we're going to raise the rates on the 20-year-old to $175 Then when you add in the taxes and fees that the government has already given the insurance companies, which averages for family of four $65 a month, that's $800 a year. So $800 a year of the $20,000 is just that.
Well, let's hope they get it worked out so we can all understand it, because we only have a short period of time.
I know.
All right. Craig Gussin, thank you for being with us tonight.
Thank you.